I'm Tommy Lee, and this is the Scam of the Week. Rick Walls from the Better Business Bureau of Northern Indiana joining us. Rick, how are you, sir?
Doing quite well, Tommy. How about you?
Good, my friend. Before we get started with today's topic, let's talk a little bit about the hurricane relief scams that are out there and the importance of finding a safe way to donate.
Yeah, definitely, Tommy. It's unfortunate that, in times like this, good people want to help those in need by donating to the legitimate relief agencies. Mm-hmm. But we always see a huge uptick in scammers taking advantage of people's giving nature. And, scammers create phony charities through social media, email, and other online platforms. They might even try to call you directly. So, BBB recommends being cautious of these emotional appeals that lack specific details about how the charity will address the needs, caused by the disaster. So, we certainly recommend, resisting that pressure to give on the spot.
Right.
If you get these calls or these, emotional pleas, right, just resist that pressure. Don't feel obligated to donate immediately, especially if you're being pressured over the phone, and really watch out for that charity confusion. That is, be cautious of the unfamiliar groups that are using names similar to well-known legitimate charities, to confuse donors.
We've made it easy at our radio stations. We've hooked up a direct line for your donations to the American Red Cross. Just text RELIEF to 45364 and get it taken care of through us in a way that can be trusted. But it never fails. Whenever there's a disaster like this, there are always going to be people who come out of the woodwork to try and take advantage of it.
Well, no doubt about it. And that's a good idea, what your station is doing. We always recommend, research that charity.
Right.
So you can rely on expert evaluation like BBB Wise Giving Alliance to find trustworthy organizations. Like I said, you've already connected with one of them. So that's a great idea.
Right.
But we recommend supporting organizations that meet all 20 of BBB's standards for charity accountability. So you can check them out on bbbsgive.org. And in fact, there's a new article that they just put out. It's called Wise Giving Wednesday, 3 Phases of Help for Hurricane Helene. And this article provides specific details on the rescue, relief, and recovery phase, and includes a list of BBB approved relief agencies. So now there are also other legitimate relief agencies out there, but BBB recommends being very cautious of that charity name confusion, because some scammers use names that sound very familiar to well-known charities in order to trick donors. So don't fall for it. Check for misspellings in the name and do your research of that organization. And never use the links or websites that come across to you in an unsolicited email or text.
Absolutely. All right, Rick, always good advice. Thank you so much. It is about time for people to start getting their insurance updated with Medicare and with healthcare.gov coverage. And open enrollment time is here, October 15th through December 7th. For Medicare, the Medicare Advantage open enrollment in January, from January 1st to March 31st, or within 3 months of getting Medicare. And healthcare.gov's open enrollment begins on November 1st, with December 15th being the last day to enroll or change plans for the coverage that starts January 1st, and January 15th being the last day to enroll for coverage starting February 1st. It's all confusing, and it's very easy for somebody to sneak in and really mess with your life by throwing a little fake insurance enrollment at you, correct?
Yeah, no doubt about it, Tommy. Just those dates you rattled off, it's confusing at best, even for people that are somewhat knowledgeable at Medicare. So, not only is open enrollment a critical time for millions of folks, but like you suggest, it's also a prime time for scammers. So they take advantage of the confusion, calling or texting people with offers to help find the best plan. And while some of the communications may be real, many of these calls are fake, and their goal is simply to steal your personal information. So whether you're dealing with Medicare or healthcare.gov, it's important to stay alert.
That's really scary. So how does this scam work, and what do people need to watch out for?
Well, Tommy, the scams usually start with, like I said, we talk about all the time, an unsolicited text or an email. And the scammer might pretend to be from Medicare, claiming to help you sign up for a new plan. So they'll ask for your personal details like your Medicare ID number, Social Security number, or even banking information. So BBB Scam Tracker often receives reports about people that got a text saying their benefits are about ready to expire unless they call back immediately. These are scams. The goal of these scams is to get you to give up sensitive information, which they can use to then commit identity theft.
That's a serious concern, and it's a really easy pitfall to fall into. So what do people need to do, Rick, to protect themselves?
Well, Tommy, as we mentioned, in so many of these scam situations, be cautious of those unsolicited texts and emails. So Medicare and healthcare.gov will never contact you out of the blue asking for your personal information. So if you get something that's requesting that, it's a scam. Now, they do, Medicare and healthcare.gov do provide legitimate help for determining which plan is right for you. But these people are sometimes called navigators or assisters, and they cannot charge for their support.
Right.
So if someone is asking you for a payment, it's a scam. And of course, always reach out to them directly through their official website or customer service lines. Again, never through clicking on a link in an unsolicited text or email.
Right.
Avoid falling for the free gifts for health screenings. So never sign up with a broker who offers you an expensive sign-up gift in exchange for providing your Medicare ID number or additional personal identifiable information. Now, other times these brokers offer free health screenings to weed out people who are less healthy. This technique is called cherry picking, and it's against Medicare rules. And of course, like we say all the time, never share your personal information. Never give out your Medicare ID number, Social Security number, health plan information, or banking information to anyone you don't know. And again, beware those suspicious links that come in texts or emails. Just don't fall for it. And if you're still employed, consult with your employer directly if you receive an unexpected email about your benefit policies.
Excellent tips, Rick. Thank you so much. Is there anything else that we should mention?
Well, Tommy, if you believe you've fallen victim to a scam, it's important to report it. So if it's a Medicare related, you can call Medicare at 1-800-MEDICARE. For healthcare.gov scams, report that to healthcare.gov or call Health Insurance Marketplace at 800-318-2596. And of course, we always ask your listeners at any time they think they've been a victim of a scam, whether they've lost money or not, report it to bbb.org/scam tracker. And again, if you've lost money, also report it to FTC at reportfraud.ftc.gov, because your story can help other folks from falling victim to that same scam.
Insurance renewal, it's a dangerous time, and you got to navigate it carefully and wisely. Rick Walls with the Better Business Bureau of Northern Indiana. Thank you as always, my friend, and we will talk again very soon.
My pleasure, Tommy. Take care now.
Podcasts by Federated Media.